Train rides in Mumbai, India are an incredible experience. It is fast, relatively cheap, and super congested. One needs to be really lucky to find a place to stand during a typical rush hour commute, and an unbelievable karma to get a place to sit. 7.5 million people are taking these rides every day. I've been one of them. I was born and raised in India, a place with millions of hyper-diverse and unique individuals, all of us traveling to our respective destinations together. I remember this middle-aged lady who, if she would get a place to sit, would start chopping vegetables on her commute. Or this elderly woman who would be chanting prayers while surviving all the hustle around her. I love these rides. I loved being exposed to this whole world of interesting realities around me. After Mumbai, I moved to the United States for my graduate school, and today I am a university physics professor. The thing that excites me the most about physics is its problem-solving aspect. How we can put together physical laws, deductions, reasonings, observations, and crunching numbers to understand behavior of complex physical systems around us. In physics, we can solve mysteries of huge scale, like how the planets move, to the tiniest, like atomic interactions. So this grad school training I was talking about was quite rigorous. And while I was really excited to embrace the process of discovery, I would sometimes find myself behind the closed doors of my laboratory, and there would be days when I would hardly get to interact with anyone outside. I sensed that it was not just a sense of physical isolation, being thousands of miles away from my friends and family in India. I had a deeper conflict. I felt like in the pursuit of being a physicist, which I always wanted to be since childhood, I was being soaked into a world of abstraction. I felt I was moving away from people from different walks who led lives different from my own. Around that time, I had a series of experiences which actually changed my life. I didn't know about that at that time, though. I had to schedule a few doctor's appointments, and I had a really tough time trying to figure out how to get to those appointments. I was a poor graduate student, so I didn't know how to drive. I didn't have a car, so I didn't drive. It was winter, so it had snowed in, and Google said my easiest transit option included 2 transfers and an additional 7 minutes of walk. Once, I missed my appointment because my bus didn't come on time, and then I ended up missing the next leg. And I just missed my appointment. That was not the worst part I figured out of the process. In trying to reschedule, I saw that there wasn't another appointment available for more than a month. Honestly, I wondered, do people without cars feel this helpless every time they have an appointment? And how many times they end up missing an appointment in this process? In a country as developed as United States, can something like not having basic transportation be such a big barrier to access healthcare? It turns out it could. 3.6 million Americans are missing or delaying appointments because they don't have proper transportation arrangements. For elderly, low income, and children, it is one of the top 3 commonly cited barriers to access care. And the result of a missed appointment is this: you are not getting timely care. This might lead to development of conditions which could have been prevented by showing up in the first place. And this vicious cycle can spiral into chronic conditions that can easily land someone in an emergency room. Imagine something like a diabetes or hypertension or infection, which is preventable by timely care if unattended, not only becomes more painful for patients, it also costs more to treat. And this cost is not just financial in nature, it is deeply personal too. The burden of being sick is much more than just the money required to fix it. It robs people of their overall quality of life. not only for themselves, but also for their loved ones. And if you think from a healthcare provider's perspective, missed appointments do lead to loss of revenue. We looked at an urban health center which had a no-show rate of 25%. 20% of them were because of transportation issues. And at a $200 per missed appointment, that is like cost of a patient visit, the healthcare center can lose up to $20,000 a week. That scales up to $1 million a year. So you see, there is an overall burden of cost for all stakeholders. Patients, because they're just having worse health outcomes. Providers, because they're providing inefficient service. And the taxpayers who are helping pay for some of these inefficient transportation and healthcare services. So you see, these are all complicated problems with different moving parts. As a scientist, I was really fascinated. But as a human, I couldn't help but empathize with these folks who were probably facing other social, economic, and cultural stressors already. I felt a pressing need to do something. And I thought it involves problem solving and people, so two things I'm really passionate about. So I just jumped in. I would like to talk to you about a few folks I got a chance to interact up close with. Marie, a warm, funny 16-year-old, she immigrated from Puerto Rico after Hurricane Maria with her parents to the United States. She has ALS and is wheelchair-bound since childhood. She has to go for her doctor's appointment every 2 weeks. In principle, she should be able to use this complimentary van service in accordance with the Americans with Disabilities Act. However, she has a couple of barriers to accessing the service. First, Marie and her parents are not fluent in English, so sometimes they cannot communicate their specific needs. And secondly, they figured out that they live outside the required radius of the service area of this van. So they might not be able to use this service at all. Then there is Tony, in his 60s. He lives in the low-income neighborhood and has had issues with substance abuse in the past. He takes the bus for his medical appointments, but he is in and out of jobs most of the time. So sometimes he doesn't have the money to pay for his rides and he misses his appointment. His friend Peter told him that they can use this elderly van service when they turn 65 or older. But neither Tony nor Peter have any idea about who runs these vehicles or where they could even go to get more information about them. Then there is Michelle, a single mother of a 12-year-old chronically ill daughter, Lauren, and a younger son, Will. They use the PT-1 transportation. According to this, the doctor writes a prescription to chronically ill and low-income patients to receive a door-to-door medical transportation. But Michelle complained that this service has a very complicated eligibility criteria coupled with an equally complex process to book and receive the service. So there would be days when Michelle would move around her work shift, make arrangements for Will's childcare, make Lauren miss her school to accommodate a medical appointment, and then this van wouldn't show up, or show up so late that they would end up missing their appointment anyway. Now, you and I can, if we are facing these problems, can just take out our cell phones and Google our next travel destination. But we need to realize we are talking about folks here who might not even have the money to pay their phone bills, or have very other legit financial, cultural, or language barriers. Now, wearing a problem solver's hat, I thought that there is an opportunity to close gap between two systems that are not currently talking to each other, healthcare and transportation. Right now, if someone has a medical appointment, they have to figure out what the time of this appointment is from the doctor's office. Then they have to independently make arrangement for transportation options that would take them to these appointments. So my collaborators and I designed this application that links healthcare providers with patient transportation schedule. This means, say, you have an appointment with Dr. X, and she has 3 open appointments that week. Using our application, the doctor's office can schedule you for the appointment that coincides with your public bus schedule, or any other schedule of your choice of transportation. Now, this would reduce missed appointment rates for the hospitals and also maybe attack the problem of loss of revenue. For patients, it makes their lives simpler, and for transportation providers, you see their transportation gets more efficiently used. So what our application is trying to do is connect dots. It is making systems like the patients, the transportation providers, and the healthcare providers, which currently live in silos, interact with each other more efficiently. Now, while this might not sound like rocket science, but it is a simple yet a very effective solution. There is another aspect of the solution. We decided to keep it open source. That means we no longer own it. So once developed, it becomes a shared source code, which is freely available to any healthcare provider across the country without any out-of-pocket cost. So, the healthcare providers can also tailor this application based on their own specific needs. In time, we bagged some federal grants that help us test this idea in different communities. We would work on gathering data to understand the extent of problems locally. We would go and meet patients at the hospital waiting rooms, at the bus stops, or in small focus group and try to learn more. We figured out that no one before asked them what were their problems and how they think they could solve their problems. And these interactions help us build connections where their unique challenges started making more sense to us. And these community interactions gave us 2 solid directions. First, the barrier to access care has a very human dimension. People are missing appointments because they find the process of scheduling transportation and thinking about the logistics so stressful. Secondly, there are cultural barriers in the system. Imagine, how would you feel if you are taking a ride with a strange driver who doesn't speak your language, if you have grown up in a community where your women don't even talk to strangers? Imagine the sheer discomfort of just interacting with a piece of phone app when you are sick and also stressing about navigating technological barriers if something goes wrong in that app. We realized that this was a strong human piece we had overlooked in the previous iteration of the solution. So my team members and I thought that just an application is not enough to solve this problem. We need a human intervention. We need a real person in the system in addition to our application. This person would help patients walk through different steps of the process, say an eligibility criteria, which is very complicated, or complex paperwork. And imagine how interacting with a person who knows your language or about your cultural difficulties make this process more seamless. And this person would have information about your transportation options, their cost, their schedule, and also information from the healthcare side, like how many times you need to visit your doctor or your desired physician's availability. So basically, what this specialist is doing is once directed to them, they will provide a case-by-case travel plan to the customers or the patients using our application. So I figured out that a strong piece of this whole project would be to put together the right team. I really believe in this old saying that if you want to go fast, you go alone, but if you want to go far, you go together. I needed to put together this team which is going to be able to solve this problem from a systemic perspective, keeping common goals in mind. And I'm really, really proud of the team that we have put together. It involves folks from the healthcare providers, from transportation authorities, from elderly and like advocates of low income and the disabled, community health workers, and some of my undergraduate students are also part of my team. They tell me they find this project really exciting. Of course, as a physics professor, it has been difficult to make the right connections that led to the formation of this team. I would have to find time outside my teaching and research schedule to do this project. But it was all worth it. I would be also taking part in conversations nationally where I would participate in conferences and where I not only got an opportunity to present what my team was up to, but I also got to know how communities across the country are trying to solve similar access issues. That means sometimes you will find me in these conferences catching up on some grading or sleep in between the different sessions, or maybe storming out of one session, trying to grab some food and trying to make it in class, like time for my next class. It has been 5 years almost that I have worked on this problem, and we have worked in Worcester, Massachusetts, in this Pioneer Valley area, and also in Jacksonville, Florida. Meanwhile, my physics career has also evolved. I'm no longer the locked-up graduate student anymore. So what I found in my own journey to the doctor's office had made me curious and also worried to some extent. And I followed these instincts in search of a solution. And what I saw was possible was very hopeful. It made me really, really hopeful. And in no small parts, thanks to this extraordinary group of stakeholders from diverse sectors I get to work with, they have a real conviction for solving this challenge. I also feel very hopeful for my own life and the world I live in. I have met a diverse array of people who face these issues, these very complex issues in their day-to-day survival. I feel somewhere all of us are touching each other's lives and traveling together. Maybe not in a bustling train through Mumbai, but maybe in our shared humanity. And I'm really humbled to be a part of this journey. The chance that I got to make a change that will make lives of these folks more simple and manageable is a very empowering feeling for me, and it helps me, and rather inspires me, to go on in this project and also in my own life. And it is in moments like these I realized how much more I have gained out of this project than I could ever give. Thank you.